a new episode of Octopuspharmacist product. As always in this series, we choose one pharmacy product and explore everything about it in detail. What is it? What is it used for? How does it work inside the body? What are its strengths? Its main uses? Its problems? Its side effects? Its drug interactions? And how safe is it during pregnancy and breastfeeding? We cover everything, step by step. In today's video, we're talking about a very important and potentially dangerous product, isotretinoin. You might say, but isn't this medicine only given with a doctor's prescription? And my answer is, yes, absolutely true. And here's where our role as pharmacists comes in. The doctor diagnoses a condition and writes the prescription. But your role as a pharmacist is to really know the patient standing in front of you and understand every detail about this medicine so we can help them get the maximum benefit while avoiding as many problems and side effects as possible. So, let's get to know isotretinoin in today's episode. Stay tuned. Peace be upon you. I'm Hussein Lutfi. Welcome to the Octopuspharmacist channel. This is a new episode of Octopuspharmacist products. First, here are today's main topics. If you want to jump to a specific section, keep watching until the title appears. But if you want to know everything about isotretinoin, then stay with me from the very first minute to the very last. As always, we'll start with the story and some key facts about isotretinoin. Many of us have seen prescriptions for this medicine, usually to treat severe acne in young people. I'm talking about cystic acne, the kind that forms large, deep, painful lumps. In some cases, isotretinoin is also given for oily, inflamed skin conditions, like those affecting the scalp. And in rare cases, it may be prescribed for certain cancers, such as acute promyelocytic leukemia. But many people don't actually know why this medicine works in all these conditions. Isotretinoin belongs to a group of drugs called oral anti-acne retinoids, which means it's a vitamin A-derived medicine taken by mouth for severe acne. Its story began in the 1960s when the pharmaceutical company Roche was studying vitamin A. They discovered that when the liver breaks down vitamin A, it produces several byproducts, and one of these was isotretinoin, also called 13-cis-retinoic acid. Naturally, this substance is found in the blood in very tiny amounts. Roche managed to make it in the lab and first tested it for treating cancers and tumors. But during these studies, they noticed two important things. First, it worked extremely well for people with very oily skin and severe acne. Second, it could cause serious birth defects because it is highly teratogenic. Back in the 60s, drug companies were already very cautious about medicines that could cause birth defects, especially after the thalidomide tragedy. So, how does isotretinoin actually work? The secret can be summed up in one scientific term: apoptosis, or programmed cell death. Every cell in our body has a small switch. If that switch is triggered, the cell releases certain proteins and enzymes and destroys itself. That's apoptosis in simple terms. And here's the key. Isotretinoin activates this process, pressing that self-destruct button in specific cells. From this, we get three main uses. 1. Severe acne, cystic acne. Isotretinoin triggers apoptosis in sebacytes, the cells that produce skin oil sebum. Less oil means acne-causing bacteria lose their food source and disappear. 2. Seborrheic dermatitis. In this scalp condition, sebacytes produce excess oil, which feeds a natural yeast called Malassezia. When it overgrows, it causes itching, redness, and inflammation. By reducing oil production, isotretinoin starves the yeast, restoring the scalp's natural balance. 3. Certain cancers. In cancers like acute promyelocytic leukemia or some cases of neuroblastoma, isotretinoin can push abnormal cells into apoptosis, helping the body destroy them naturally. So in the end, the main strength of isotretinoin is its ability to trigger targeted cell self-destruction. That's the foundation of its benefits and the reason for its strict precautions. The second topic in today's episode, the problems, side effects, and disadvantages of isotretinoin. As a pharmacist, it's your job to explain these clearly to the patient, how they appear, how to reduce them, and when to stop the medicine. And remember, all of these issues are linked to sebasite apoptosis, the very same process that makes a drug work. 1. The most serious problem, birth defects, teratogenicity. When an embryo is developing, cells are dividing and tissues are growing. If isotretinoin interferes, it can easily, even at small doses, cause severe birth defects or lead to miscarriage. The solution: any woman who could become pregnant must do a pregnancy test before starting the treatment. Every month during treatment, she must repeat the pregnancy test. 2 reliable forms of contraception should be used the entire time. If a woman becomes pregnant while on isotretinoin, stop the medicine immediately and send her to the doctor to check for possible harm. If she is breastfeeding, the drug is also dangerous. Even a single capsule can pass into breast milk and stay in the baby's system for days. So, isotretinoin should never be used during breastfeeding. Two, skin and mucous membrane dryness. Isotretinoin reduces the activity of cells that keep the skin and mucous membranes moist. This can cause dryness in skin, lips, eyes, and body. Advice for patients: drink plenty of water, about 1 liter for every 30 kilograms of body weight. Use moisturizing eye drops during the day and an eye gel before bed. Avoid contact lenses if possible, as they can worsen eye dryness and irritation. Use a rich lip balm frequently. Take omega-3 supplements, which can also help with triglycerides. Apply a good moisturizing lotion regularly. Use sunscreen daily, as dryness increases sun sensitivity. Three, liver effects. By triggering apoptosis in liver cells, isotretinoin can cause 2 main issues. A. Increased liver enzymes, all AST. These enzymes normally stay inside liver cells. When cells die, they release the enzymes into the blood. Slight increases are common during treatment. But if levels rise to more than 3 times the baseline, the medicine should be stopped. Monitoring. Check liver enzymes before treatment, then every 2 months. B. Increased blood fats, LDL triglycerides. When liver cells break down, they can release fats into the blood. High LDL cholesterol can be managed with diet or medication if needed. High triglycerides are more dangerous. If they stay below 500 milligrams per deciliter, treatment can continue with omega-3 supplements to help. If they rise above 500 milligrams per deciliter, stop isotretinoin immediately, as high triglycerides can cause pancreatitis. Monitoring. Check cholesterol and triglycerides before treatment, then every 2 months. Four, muscle effects. Rarely, isotretinoin can cause muscle cell breakdown, rhabdomyolysis, leading to muscle pain and weakness. Management options. 1. Stop the medicine until symptoms fully disappear, then restart at a lower dose. 2. Continue treatment but reduce the dose, increasing slowly over time. 3. Continue at a lower dose and add coenzyme Q10, 200 milligrams per day, to support muscle health. In short, isotretinoin can be highly effective but requires close monitoring, clear patient education, and careful dose adjustments to manage risks. The fifth problem with isotretinoin is its possible effect on the pancreas. If it irritates the pancreas, this can lead to severe diarrhea or vomiting, sometimes with blood. If there's fresh red blood in diarrhea, it usually means bleeding in the lower part of the digestive tract. If there's black, tarry stool, or vomiting of dark blood, it suggests bleeding higher up. The solution: tell patients, If any of these symptoms appear, stop isotretinoin immediately and see a doctor. The sixth problem: isotretinoin stays in the body for about 1 month after the last dose. During this time, blood donation is not allowed because a drug could be transferred to a pregnant woman through donated blood, risking birth defects or miscarriage. The seventh problem: effects on mood and the nervous system. Some people may develop or worsen depression while taking isotretinoin. If the patient already has depression, it should be avoided. If new symptoms appear, the medicine must be stopped. The eighth problem: effects on bone growth in children. Isotretinoin can close the growth plates and bones, stopping further growth. For this reason, it's generally not used under 18 years old, except in rare, serious cases. Important monitoring points. 1. Pregnancy tests before starting and every month of pregnancy is possible. Use 2 forms of contraception. 2. Blood tests before starting and every 2 months. Check liver enzymes, ALT, AST, and blood fats, cholesterol, triglycerides. Dosing in acne. Usual dose: 0.5 milligrams per kg per day, divided into 1 to 2 doses. Example: 80 kilograms person 40 milligrams daily, split morning and evening. Some doctors start low and increase gradually to reduce side effects. Treatment usually lasts 5 months. In resistant acne, dose may be increased to 1 to 2 milligrams per kg per day. In certain other diseases, tumors, severe skin disorders like Darier's disease or keratosis follicularis, dose may reach 4 milligrams per kg per day, divided throughout the day. Drug interactions to avoid. 1. Tetracyclines, e.g. doxycycline, minocycline, combining with isotretinoin can cause pseudotumor cerebri, a dangerous increase in brain pressure. Always stop tetracyclines before starting isotretinoin. 2. Vitamin A supplements. Both are forms of vitamin A, and combining them increases the risk of liver damage, high cholesterol, and side effects. Normal food sources like carrots are safe. Food high in pure vitamin A, like liver, should be avoided. 3. Fluoroquinolone antibiotics, ciprofloxacin, moxifloxacin, levofloxacin, gadafloxacin. These increase skin sensitivity to sunlight, which is already worsened by isotretinoin. Combining them can cause extreme redness, burning, and rashes, even from normal daylight. Now you have a complete essential guide to isotretinoin, its uses, side effects, precautions, dosing, and dangerous interactions. That's the end of today's Octopus Pharmacist Products episode. I hope you learned something new and useful. Don't forget to like, subscribe, and share, and support the channel on Patreon, PayPal, and YouTube. Have a great day.